My name is Amy Jo Jenkins, and I am the Associate Director for Administration in the Winthrop P. Rockefeller Cancer Institute. And we are here today to learn more and talk about our Rural Research Award Program. I'm going to give you some general information, and then several of my colleagues are going to proceed with various details. If you're new to the program, just listen. If you participated or learned about it last year, we've actually made quite a few changes, and we'll be sure to point out where those changes are as we go through the presentation. So next slide, Nia. Okay, since you are interested in cancer research, I suspect that these statistics are not new to you, but I do want to point them out just in case you haven't heard them before. But Arkansas does lead the nation in cancer mortality, ranking number 5. I know those of us who have lived here for a while kind of like to make jokes about being number 1 or number 2 all the time, and 5 doesn't sound so bad. But I think we can all agree that cancer is no laughing matter, and this is dismal, and we need to continue to work together to try to improve that for the people that live in Arkansas and subsequently the nation. So lung cancer is the leading cause of cancer death in both men and women, with trends in male rates decreasing faster than in female rates. And between the years of 1997 and 2017, over 126,000 Arkansas residents were diagnosed with cancer. So that translates into about 630 per 100,000 people in our rural areas, compared to the national average in urban areas of 528.1 per 100,000. So that's a significant difference there. And then we all probably know and have learned that cancer mortality rates are higher generally in rural areas versus urban areas. And so that is one of the motivating factors for this program. Next slide. So this program in particular, since the Cancer Institute is sponsoring it, is focused on cancer research only. But we are striving to still address those types of problems in rural Arkansas populations. And the goal of the funding mechanism is, of course, to provide you with a mechanism to have seed data or pilot data to be able to apply for larger awards with NIH. Now, we plan to give priority to projects focused on prostate, colon, breast, and or lung cancer, patient outcomes, screening and prevention, and or other cancer health disparities. I think that is very broad. But if your topic of choice doesn't fit one of those, please don't hesitate to apply. We are interested in all ideas, but we are primarily focusing on that. This is a change from the previous RFA that went out. And you will learn more about the Rural Research Network as this presentation goes on. But use of the Rural Research Network is encouraged, but it's not required. So as Veronica and Dr. McElfish present about that, if that sounds like something that fits your project, that's great. But if not, again, please don't let that stop you from applying for the award. Next, Nia. Okay, so we plan to fund up to 3 studies with a maximum budget of $100,000 each. And funding will be for an 18-month period. And we're really hoping that you don't request a no-cost extension, because we don't want to give it to you, which is one of the reasons that this award is for 18 months and not 12 months. So as you're thinking about your project, really concentrate on what can be done in an 18-month period. Next. Okay, so this is also a big change from last year, and we're hoping that it will encourage more of you to apply. But it is open to all faculty members at UAMS, at Arkansas Children's and ACRI, the VA, and or U of A in Fayetteville with a rank of assistant professor or above. The previous awards from last year were only open to Cancer Institute members. And while priority will be given to teams that have a member on their team, it is certainly not required. So again, please don't let that stop you if this is all new to you. If you want to learn more about what it means to be a member of the Cancer Institute, there is a link there, and I know that Nia will provide these to you if she hasn't already, so that you can access that. And if you have any questions about that, please just let me know. Okay, next. So I'm going to pass on the presentation to my colleague, Nia Indelicato. She is a research program manager in the Cancer Institute and will be the administrator for this award, and will know all things about it. So Nia?
Thank you, Amy Jo. So I'm going to talk to you a little bit about the actual process of applying for the award and a little bit about our review process. If you have any questions, we will have Q&A at the end, so you can feel free to hold until the end. But if something occurs to you and you want to put it in the chat, that's fine. I probably won't be able to see the chat until I am done. Amy Jo can look at it, and Veronica can also maybe answer some questions. So if you do have questions, feel free to put them in the chat. We will get to them eventually, I do promise. But I'm sort of driving the slides, so it is harder for me to pay attention to the chat. Okay, so first I'm going to talk a little bit about the application process. So we use a letter of intent process to save both you guys time and us time. We require a small amount of effort into a letter of intent so we can kind of assess what projects people are thinking about, and then we can tell you, yes, this is something we'd like to hear more about, or no, this is not something we don't want, we want to hear more about. And then that'll help you guys focus on putting time into something that has a better chance of being funded. So after we look at the letter of intent, we'll decide a smaller group of people who we will ask to submit a full application, and we will give those people the information on how to submit the full application. So I did email everyone. Hopefully you did receive my email with a link to the website that has where you can download it. I'm just going to pull over the website really quick. Just bear with me so you can see what website I'm talking about. Hopefully you can see that. Let me expand. And this has a little bit of information about the program in general and our timeline. And near the bottom, kind of above that timeline, you can download the RFA. And then right now, this is where you registered for the information session. But once we have this recording all done and edited, we're going to put it on the website. So this link right here will be replaced with a link where you can watch this recording and also access the slides in case you need them. But if you need to download the RFA, you just click there. It is the RFA plus it is the actual letter of intent template that you will use to fill out a letter of intent. So there is a specific template that we do want you to use. Minimize that. Okay. So as I said, I did email you that information. I'm going to email everyone the slides as well, and I will probably also include the link to the website in there as well. So you should have plenty of opportunity to have that easily at your fingertips. So let's talk a little bit about the letter of intent content. So what we're basically going to be asking you for are these things. Now there's some more direction in that template, but I wanted to kind of go over in general what we'll be asking you to provide us. We do want a brief summary of the project. It needs to be written with a diverse scientific audience in mind. So I would suggest not getting too technical into the nitty-gritty of the science in case somebody reviewing it, the people reviewing it will be scientists, but in case somebody review it isn't an expert on a very narrow field that you deal in, please write it so pretty much anyone from UAMS could read it and judge its merits. We want you to tell us the need. Why do we need to fund your project? Why is it unique? What is innovative about your project? Of course, we will ask you about the rural health focus. I always tell people that this is a very subjective sort of thing. It's really up to you to explain to us why your project benefits a rural health population. I have seen people who have projects in various previous lifetimes at UMS, when I dealt with other projects, I have seen people that have projects that maybe at face value you might not the rural aspect might not be very clear, but when you read how they argue that this thing is a rural project, you go, oh, of course it's a rural project. So please use that space to be convincing that this is a need for rural populations, and think creatively. We want to know a little bit about your scientific approach. It's not anything extensive, but we do want to know what you plan on doing. Also very important is your plan for extramural funding. We want very specific information here. We don't want vague, like, well, there's the grant that I think I might apply to, or I heard that, the NCI is funding something such or such. Please tell us what actual mechanism you plan on applying for and how you plan to work to obtain that funding. And then we will need
a page limit?
There is on the information session on the template for the letter of intent. There is some information about how long it's bound to. I think it's about a page and a half ish is what you have to write this. So it's not a whole lot of space. That does not include the biosketch for the PIs. So the PI biosketches and the biosketches for the COIs, we're asking for the most recent NIH biosketch format, which is limited to 5 pages, but those pages obviously do not count in the page limits for the other stuff. So submitting the LOI. So basically you're going to take that cover sheet that is part of the download, fill that out, create your narrative that it covered all the things I just went over, take your biosketches, you're going to combine them into one single PDF, and you need to email them to me, and they are due by May 2nd at 4 p.m. So anything we receive after that will probably not be accepted. If there's some sort of crazy circumstances, talk to me ahead of time and we can figure it out, but pretty much they need to be in by 4 p.m. And don't wait until 3:54 to start combining your all your things into one PDF and then have problems and then not be able to figure it out. So LOI review and selection. So I talked a little bit about this, that we will review them and we'll select who we want to proceed on to the full invitation. We have an advisory team which is made up of representatives from the Cancer Institute and the Translational Research Institute. We will get together and look over those letters of intent, and we're going to kind of judge them based on the content, the feasibility of the project. That's really important. Again, like Amy Jo mentioned, we want projects that can take place in 18 months for the amount of money you are talking about. So we want to look at that a little bit. We're going to consider the potential for impact, the potential that this will get a future grant, and then of course our priority areas. As Amy Jo mentioned, we do have some priority areas, but if your project doesn't necessarily fall within those, that is perfectly okay. Please submit. You might find yourself being invited to a full application, because really it's kind of a little bit of a subjective process of our overall opinion of your letter of intent. So now I'll talk a little bit about the full application requirements. So the actual full application directions I will send out to the people that get invited, but I do want to go over a few things that we do require as part of that process, so everyone is sort of forewarned / has a good idea of the work that will go into the full application. So you may be required / will probably require to have some sort of meeting with the RAP advisory team. It'll be based on what is in your letter of intent. So if your letter of intent includes information about how you want to use the Rural Research Network, we'll probably make you meet with Veronica to talk a little bit about that. We might ask you to meet with us with a draft budget so we can review that and just make sure that you are clear on how your budget goes. So depending on what is in your letter of intent and what your project includes, we may ask you to meet with the RAP team. We will require you to talk to our shared biostatistics review resources. We'll help set you up a meeting with them. They'll kind of go over biostatistical consultation with you guys to make sure your project is spot on in that regard. Again, specific details on like how you set up these consultations and what is required will be in the full application instructions, but I do want people to know that if you are a full applicant, there's probably 1 or 2, maybe 3 meetings that you might have to do as part of this application process. All the research is also going to be subject to some pre-reviews and approvals. So all cancer-related research that involves clinical research where you're recruiting people must go through our 2-stage scientific pre-review process. It's 2 stages. So first, you would have to go through your appropriate disease-oriented committee. A lot of you are probably know what your appropriate disease-oriented committee is, but if you do not, we can help you identify the correct doc to go through and their processes for submitting and getting it approved. We are requiring that everyone submit their information to the relevant doc by June 13th. After their doc is approved, then it has to go through the Protocol Review and Monitoring Committee, or the PRMC. So that has to be submitted, not necessarily approved, but submitted to the PRMC by July 20th. So that gives you a little bit, around a month for the doc to review it and say it's good to go, and for you to get it into the Protocol Review and Monitoring Committee. So that kind of takes you on the road to the pre-approvals. Again, we're going to give you very specific information in the full application process, and the good news is I kind of run the PRMC, so I can help people shepherd people through this process if it is needed, and we'll work with you on a one-on-one basis. But we do want you to know that this is a requirement that has to happen. There are also regulatory approvals. So IRB and IACUC, if it applies to you, submissions. That process happens in tandem with that doc and PRMC review process I just talked about. So they're going to be happening at the exact same time. You have to submit to the IRB and or IACUC by June 13th, 2022, and you must have their approval by September 1st, which is when these grants would start. If your project is exempt from IRB, you have to provide the official letter that's from the IRB that says this is an exempt project. You can't just say, well, I know it's exempt, it's fine. You need to go through, in CLARA, there's a process where you submit to see if it's exempt. And if you do that process and it is indeed exempt, you will get an official letter that says this is exempt. That we have to see. We have to see either that or those approvals. So review and decision process. First, we'll pass everything through an administrative review. That's basically just me checking all your applications to make sure that they are complete. Nothing gigantic is missing, and you haven't done anything, wrong. And then after that is done, it'll get a scientific review. We'll find reviewers from UIMS to look over your application, review it for scientific merit. Those sort of scores and opinions will then be passed on to the RAP advisory team, and we'll kind of select the ones that we think are the most worthy of funding. And then Dr. Beer gets to give us a thumbs up on the ones that we think that are worthy of funding. So that's kind of our review process. It sounds very complicated, but it's really not. It'll go through all of those pretty quickly. So our overall timeline. So again, just a reminder, your LOIs are due on May 2nd, so that's a little less than a month away. There's different dates within the full application process. The full applications, if you are invited, will be due on June 27th. We kind of let you know by May 16th if you're invited. So that's about a little over a month for you to do your full application. And then we should be letting people know by August 1st if they are funded. And then your start dates should be September 1st through November 1st. Hopefully closer to September 1st, but sometimes things just happen and you can't get it started by September 1st, but we do want them started somewhere between September, October, and November. And that is all I have. I'm going to turn it over to Dr. McElfus, who's going to talk a little bit about rural research.
Yes, thank you so much, Nia. And as Nia said, as someone who applied for several TRI projects early in my career. Nia is wonderful at keeping you very well informed with this and responding to you and letting you know when she receives your items. So everyone will love working with Nia on this. I really wanted to provide a bit of context about rural background. I think this is my only slide of just saying 42% of Arkansans live in rural areas. And I think this plays into what Nia said. There are probably 20 different definitions of rural. And for the purposes of this RFA, we did not select one specific definition. So we're not only using, census level codes or the USDA's definition. It is a broad interpretation of rural, with the understanding that approximately 50% of our state is rural. And so while there are things that would not be appropriate, like only doing a study that was of people who lived in Little Rock, and we're in the urban center, studies beyond that include all of Arkansas and are able to look at rural urban difference. There's really that broad look. Why we are interested in rural is among those cancer, and we should probably update this with specific cancer items, but we know that obesity is a cancer risk, smoking rates, physical activity are all disparate in rural areas, and that there is reduced access to primary care and specialty physicians, lower rates of insurance, distrust, higher rates of poverty, and drug abuse, including opioid. So that there are a number of disparities, and that is why we are interested in improving rural health as a way to improve health outcomes overall, and specifically cancer health outcomes with this research. And you can go the next slide, although I think the next slide is going to shift over to Veronica. So Veronica, thank you.
Good afternoon. So thank you for the opportunity to share the network with you. I'm going to give you a very brief overview of the network because I know that we have limited time available, but it is a statewide intra-institutional partnership consisting of multiple programs and institutes within UAMS, including the UAMS Translational Research Institute, where I am housed and our program is administered. UAMS regional campuses, so all the 8 campuses across the state, and as Pearl mentioned, we consider all 8 regional sites rural. The UAMS Community Health and Research Office, led by Dr. McElfish, and also the Winthrop P. Rockefeller Cancer Institute with Dr. Beer's leadership. The network was established in 2020, so we're a fairly new program. Our aims are to establish a sustainable research infrastructure across all UAMS regional programs, leverage the existing clinical and educational infrastructure of regional programs for research purposes, and to help ensure that Arkansas's rural populations are included in clinical and translational research. We're also wanting to establish a mechanism for developing internally and externally funded research proposals for implementation in UAMS regional programs. And of course, this mechanism does just that. Next slide. Thank you. And then we do that by utilizing the regional campuses across the state. They serve as our study sites for the research that we do. And then each site does offer different opportunities, resources, and access to special populations, which is one of the reasons why we offer a consultation with the network, so we can help you determine the best site that would benefit your research work. This is just a quick overview of the resources. We're not going to go through all of these, just to note that we do have a number of research coordinators at the different sites. And there's also a telehealth training center that's being established in Helena. And also, I'm sorry, Nia, can you go back, please? Yes, thank you. And that in Helena, there's also not necessarily a residency program, but they do have a great community established groups there to help with community-based research. And so it's really nice to get to know each of the different sites and the resources that they offer. Next slide. Each of the sites does have the capability to do telehealth and telemedicine research work. And we've been working with the different sites to establish that, to be able to really expand upon their medical uses for the room and move it more into also doing some research work there. And this is just the example that is in Batesville, but they all look very similar. We have been establishing our network infrastructure over the last couple of years. We've been building out our research opportunities, and you can see here we have a good team of individuals that are our bases for our research purposes. We do have support from Dr. Beer and the Cancer Institute, as well as from regional programs and TRI, and enjoy working with all of these individuals who are extremely capable of assisting with research purposes. So the requirements to engage support from the network, we do require that you budget for the use of the network's research support team. We are similar to a fee-for-service group, and so we will also work with you very closely to establish budgets that are related to utilizing our resources, and including all the related costs associated with conducting your research if you choose to utilize the Rural Research Network or any of our study sites. We also ask that you receive your approved protocol, that we receive that, and that we establish a memorandum of understanding with you so that you're very clear as to who is responsible for which rows of doing your research. And we also ask, because we are administered within TRI, that you cite TRI and that you acknowledge the rural research when presenting or publishing. So because we are a fee-for-service, some of our services that we include are study startup activities, study coordination and project management. We do beta testing prior to launching your study. We do study implementation and workflow within the clinical setting. Our research coordinators include services such as scheduling, screening, enrolling, consenting, collecting data and biometrics, and ensuring regulatory adherence. We do engage clinical services within the regional programs when they are available to do so. Once again, all of this is at a cost. Point of contact, I serve as your point of contact for research within.
We lost you, Veronica. You might have to repeat. It's
Just
cut out
the
a little.
last two bullets. Yeah, can you repeat your last two? We heard
Sure.
you point of contact, and then I guess the last one bullet.
Yes. So we also provide research oversight and facilitation of research within regional programs. So I wanted to just provide you with a couple of examples of the research that we've done, and we've done quite a few projects, but I pulled the ones that I felt that might give you sort of a broad array of the work that we're doing. One of the studies that we did was an Arkansas seroprevalence study, where we were able to help contribute some of the samples that were needed for the study to provide a diverse group or a diverse representation of the state of Arkansas. And so you can see here that we contributed over 2,000 samples toward the overall samples for this study. And we worked with Dr. Josh Kennedy and as you can see, a number of investigators and research staff to be able to contribute and be a part of that study. So this study, sorry, Nia went back again. This study was simply just obtaining leftover samples from the labs of the different sites. And so we were able to contribute from 3 sites because they had in-house laboratory at that time. But now all of our regional sites have actually expanded to in-house laboratories. So we'll be able to contribute more samples toward research studies. Next slide. Another example of a study would be expanding telehealth research. We've been working with Dr. Vermani, and he simply needed to be able to do his research within regional programs. He has his own study team, but he needed some extra help facilitating the research within regional programs. So we were able to provide that support, and that is actually an ongoing study. So we're happy to work with Dr. Vermani and his study team. Next slide. And then a food insecurity study. This is a little bit more complex study, randomized control trial, working with multiple different sites, enrolling and consenting. So our study team or our research coordinators work very closely with Dr. Long's study team to be able to implement his project within regional programs. So this is very much more of a complex study where it has baseline data collection, an educational consult with a diabetes educator, and then a follow-up appointment, as well as 6, 12, and a 12-month follow-up appointment. And we assist with all of those activities for this particular study. So the way that you can ask for support from the network is simply to go on the TRI portal, and you can see I've highlighted the section for you that you would select to be able to request a consult. And just want to acknowledge Dr. McElfish and her team, as well as all of the funding agencies that have supported the network in the last couple of years. Thank you.
Okay, so we will open it up in just a second for any questions and answers from anybody here that wants to ask something out loud. But should you need your questions answered in the future, both Veronica and I are happy to answer any questions. Again, I'm kind of more your process for applying contact, and Veronica is more your contact for the sort of Rural Research Network questions. But if you accidentally send a question to us that belongs to the other, we will forward it on, no problem. But now I will open it to see if anybody has any questions. Feel free to just unmute yourself and speak out. I know it's late in the afternoon and people are probably tired, but we are happy to answer questions.
I have a question about one of the studies that was mentioned where you mentioned that there was remnant, I guess, blood samples or serum samples that were used for that large COVID study. I assume that those samples were de-identified.
Yes, absolutely.
And so that's, but were they able to link to some sort of clinical metrics, et cetera? And if you do a certain study like that, do you get resources from the RRN to help with the IRB?
Yeah, so since the network is a part of TRI, there are services provided for the investigators through the regular IRB resources that are available through TRI. And I can certainly help connect investigators to that resource. Yes, they were de-identified samples, and yes, they were able to link to some demographic information, but it was very limited.
Yeah, I think we were at least able to get race, ethnicity, sex, and age range. So we were able to do some reasonable analysis to differentiate, but we did not have prior diagnosis or anything like that.
That's correct.
Any other questions? Hearing none, we can kind of close the meeting, but again, please feel free to ask questions as you read over the RFA. If you have any questions, please reach out to us. We are more than happy to help. And please feel free to also spread the word that there will be a recording of this probably Monday-ish. We'll get that up on the website, and spread it around because we would love to have so many applications we don't know what to do. That would be ideal, really. But thank you for coming. Have a great evening, everybody.